Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here on Health Professional Radio. You know, cancer information has not been readily shared over the past several years. Now, up until just a couple of years ago, most hospitals and treatment centers didn't share information about their cancer patients. But at the forefront of an information sharing revolution is our guest in studio today, Dr. Bradford Hesse and Dr. David Ahern, both of which are with National Cancer Institute and also authors of the book Oncology Informatics, Using Health Information Technology to Improve Processes and Outcomes in Cancer. Welcome to the program, doctors.
Thank you.
Thank you.
It's our pleasure.
Thank you.
Dr. Hesse, as co-author of this new book, tell our listeners what Oncology Informatics actually is.
The notion of informatics is the use of health information technology to improve the way that we deliver care in medicine, and very particularly how we transport information around the system of medicine to support patients. So the book on oncology informatics deals very specifically with all the issues that we care about when it comes to cancer. And that includes how to prevent cancers from happening in the first place, something we refer to as preventive oncology, how we can help patients detect their cancers early, how we can help them during a course of treatment, when we know patients may end up seeing something like 7 to 13 different specialists, and then how to help them as survivors after they get over that treatment phase and they're now back working with their primary care and all the other aspects of their lives. So oncology informatics we see as the technology force and the communication needed to be able to bring all those facets together to help serve cancer patients.
You know, when it comes to cancer, it seems as though in the past, not up until just a couple of years ago, in the past, the information at one facility to prevent cancer or the cause of cancer was going to be different than someone would get at the information center down the street. But now everyone's going to be on the same page. It seems like preventing cancer, we all get the same message, say in commercials. Why weren't we on the same page before?
I think go ahead, Dr. Ahern.
Thank you, Dr. Hesse. There are a variety of reasons as to why there isn't consistent approach, a consistency in approach, or what we call variation in care or care quality from one center to another, or from one hospital or practice to another. And part of it is the complexity of cancer. It's a very complex set of diseases. It's not a single disease. And part of what is exciting about the opportunity to improve cancer detection and treatment and care over time now is because we're having a better job of understanding the nature, the biology of cancers. And that's sort of part of what we're taking advantage of with our work is just a rapidly expanding evidence base about the underlying genomics and genetics of cancers. With that, but that has also created an enormous demand for information and ability to collect and store and share information in order to better understand the unique profile of cancer types. And each person may have a particularly unique type that requires a particular approach, and it's a more tailored or precision approach. And the informatics aspect is that technology can enable that kind of more tailored precision care. And in order to do that consistently, back to this variation problem we've seen in healthcare, not just in cancer, is that we need to be able to share that information so that there's greater ability to provide those precision treatments. So that's sort of part of the story as to why now and what has been the problem. I think we talked a bit about the need for electronic records and the ability to have basic structured data, but then that's only a start. You have to be able to move that data to the appropriate place, the appropriate practice group, to the appropriate provider at the right point in time for that particular patient with that particular profile. So there's a bit of that kind of coordination that now is doable with informatics that wasn't really doable even 5 years ago.
Are we talking informatics and this new revolution in information sharing simply here in the United States, or are we talking on a global scale? Because understanding what causes cancer here by sharing information between ourselves much quicker, if we can do that, we maybe can understand what's causing a cancer there that we had no clue, 5 years ago, as you said. Is that something that you're considering, or is that in the works now?
Yeah, no, I think you're exactly right. I think a lot about what Tom Friedman, I think, discussed once when he was saying that the world is flat because of this communication and information technology that we have at a global scale now. With cancer, that means that we can share information across parts of the globe as we figure out what's causing cancer and what the best treatments are. We can also eventually, and we're not quite there yet, it's going to take us a while, but eventually I think be able to follow patients who go beyond the reach of, let's say, where they live currently in maybe the United States. Maybe they want to go and visit another country, and while in that country they have a problem and they immediately need to get access to their health record. Wouldn't it be wonderful if we could eventually get to the stage where we can do that with them? We can do that with their finances, but we're having a harder time doing that with medicine, but we want to reach toward that path. And we think that these are the necessary first steps to go down that path to make it a kind of a global support system.
Do you think that there's a higher percentage that is resistance to change as more than access or lack thereof to the information much quicker now? Do you think that there's just simply maybe a mental block that is causing some of the delay?
Yes, sometimes that is what happens. It's a big cultural change, and we have to do things differently. And we hear this play out often in, to be very honest, political spheres, even on whether we should share information or whether this should be something that's market-driven. There are a lot of those kinds of discussions that are going on right now. But I think what's happening is that because of the HITECH Act, now people are exposed, for better or for worse, to these new connected systems. They may complain about the fact that it's a lot of work and we need to improve these systems for them. But at the same time, if we say we're going to take that away and make it so you can't share your information, they resist. They say, no, now we know what it looks like. Now we definitely do want to be able to share that information. And the patients whose records have become mobile where they weren't before, they also are looking at that and saying, don't take that away from me. So we're at the beginning of a change, I think, even psychologically, on people's willingness to be able to share that information.
Now, in wrapping up,
and Neal,
yes, go ahead.
But I have just one other comment. I'll be brief, but I think it's a great point that Brad was alluding to. It actually there's a pretty significant consumer or patient demand to have not only have his or her own health information, but also to make sure that that information is available to the providers that they elect to choose, they go to for care and where they may end up for care. So it's not only is it the health system or the provider community that is needing to respond to mandates from federal mandates to share through acts in Congress. There's a major consumer demand and consumer force now to move data to where I'm at my particular point of need, as opposed to requiring me to move to some place to get data. That data should follow me is sort of the philosophy that's driving a lot of this. And that's a powerful force, and providers and provider systems and health systems are really recognizing that.
Now, in wrapping up, your book, Oncology Informatics, it's in its first edition, Using Health Information Technology to Improve Processes and Outcomes in Cancer. Could you tell our listeners where they can go and quickly get a copy of this book?
Well, you can go to the Elsevier website, and if you just type in the search bar, Oncology Informatics, I think it comes up as the first on the list, and it's available there through the Elsevier store. But it's also available, as many, if not most, books are today on Amazon.com, where you can find the book as well.
Dr. Hesse and Dr. Ahern, thank you both for being here this afternoon.
You're welcome. It's our pleasure.
You're welcome.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and also at healthprofessionalradio.com.au, and you can subscribe to this podcast on iTunes.